is Marissa McCarthy. I'm a physical medicine and rehab physician. I have a subspecialty in brain injury medicine. I've been working in this field for over 20 years. So I started medical school many years ago, graduated from the University of Miami. I chose to do a residency in physical medicine and rehabilitation. So that particular specialty works with individuals that have sustained catastrophic injuries. So anything from spinal cord injury to brain injury to stroke, amputations, and those can occur from any, things, whether it's combat, car accidents, slip and falls. So I've really been exposed to the catastrophically injured population for a long period of time. During my training, I fell in love with the brain, and I really wanted to know what the brain could do, because the brain has the ability to repair and recover itself, unlike some other organs that we have inside our bodies. So for me, the brain was what I really wanted to understand better. I think knowing that every brain injury is different. You can't compare one individual to the next. So you have to treat each person as if they're their own, because the way that people recover is very different from one person to the next. As a physician, learning to have a bedside manner can come naturally or unnaturally. But finding a touch point where you have a commonality is really the path that I've chosen over the years. It's pretty easy to connect with individuals, whether it's on some type of familiar hobby that you may have. It could be something that they're wearing. It could be something that a family member says when they come in the room. So you really just find it as you're interacting with them. In a performance-based environment, obviously, that individual wants to recover as quickly as possible. So one of the things that's really important to educate the individual and their family members is that we want them to recover as quickly as possible too, but we also want to make sure that that return is as safe as possible. What sets TPL apart is the fact that we have everything all in one place. We have the ability to image people here, we have the ability to assess people here, and we have the ability to treat people here. If someone has a brain injury, they may have also had a fracture of an extremity. So we have the ability to work with other specialists that may be more of the bone specialist, where I focus on the brain. So we have that interdisciplinary level of care. So again, we can treat each person as an individual, but gathering all the minds of those that are supporting the recovery. So in the brain health space, there's a lot of controversy when it comes to, what is up and coming. And a lot of times there are modalities that are not necessarily approved, by the FDA for recovery. However, over the years of experience, we are able to incorporate both traditional and non-traditional means of recovery during brain injury. So for example, we know that cognitive therapy can assist an individual with memory dysfunction or executive dysfunction. If there's a vestibular problem, we can incorporate audiology, vision therapy, physical therapy to help improve the balance and the dizziness that sometimes happens with individuals that have brain injuries. A lot of people suffer from headaches, so we can address those issues as well. Finally, there's a lot of other things that come along with brain injury that can include emotional aspects like anxiety and depression. So we are also able to attack that as well. But I will tell you the most important thing is sleep. Sleep is how the brain recovers. So if we can get people into deep sleep, then we know that we have recovery and repair happening at that time. So that, for me, is the biggest aspect in terms of brain injury recovery. Now, we also have some fun, unique tools that we can use. For example, hyperbaric oxygen. Although it's not FDA approved, there have been some studies, and there's currently an ongoing study at one of our local universities on how hyperbaric oxygen can help improve traumatic brain injury recovery. We actually utilize music therapy for many different ways in terms of recovery. We use it for walking. Believe it or not, you have almost like an internal metronome. I don't know if anyone's ever played the piano or you sat there with, the beat, right? And that beat allows you to walk at a normal pattern. It also allows you to speak at a normal pattern. In addition to that, there are songs that we learn as children that remain even after you've had a brain injury. For example, Happy Birthday. So you're going to know that song, for the rest of your life. So we can tap into that area of the brain that knows those particular tunes, and then we can use augment speech recovery, especially after brain injury. So it may sound funny, but when a person is not able to speak, they can actually sing what they want to say. Hi, I'm Marissa McCarthy. Welcome to the Performance Lab.